Hey, hello everybody. This is Dr. Ken Muich from the Fibromyalgia Wellness Center, and we're going to be talking about the subject today concerning pharmaceuticals. And if they're not working for you, why are you still taking them? It's very, very interesting. Last night, I had a chance to just kind of relax after a hectic weekend, and so I turned the TV on and just to watch a couple of programs, be brought up to date with maybe news and so forth. And lo and behold, I get inundated by pharmaceutical advertisements. It's almost like the condition of the month. The most common one seen was for psoriatic arthritis. Matter of fact, I changed the station because the commercial was on. And lo and behold, it was the same commercial for the same medication. Hey, look, I'm not against pharmaceuticals. Believe me, I'm not against pharmaceuticals at all. If they are used in a proper sense, if they're used in a proper sense that says, okay, it's for a specific condition and short term, and it's for your condition, and there's no side effects that actually mimic the same symptoms that you have. So that's the most important things. Look, if you're really going to have to take medications, all right, I understand that because sometimes the body is in such a condition or way that you're just not going to be able to your body's not be able to heal itself properly. And that does happen at times. Hey, listen, with our immune system constantly stressed with all sorts of things that we're involved with, that we've covered with bad foods and stresses and strains from work and you name it, obviously that is a real problem that we have to deal with. But keep in mind, last time I talked to you about medications and so forth and how it adversely affects your gray matter of your brain, that part which is for memory and concentration. Remember that study from 2004, Northwestern University did a long-term study, and they found that chronic pain actually causes a loss of gray matter. How much? About 10% over a 15 to 20 year period. Now look, that's really important because if you have a chronic condition, like say for example, fibromyalgia or some other chronic condition, and you're under medications. And I can't tell you how many fibromyalgia patients that have come into my clinic, and I ask them the question, well, when was the diagnosis, or how long have you had this condition? And many of them say, as long as I can remember, when I was a little kid, and this is decades ago. Well, if you're talking about decades, think of how that's adversely affecting your gray matter of your brain. It can be a really long-term problem. So we want to make sure that if you're taking medications, okay, that they work. Yeah, keep in mind that there's about 6 to 8 million fibromyalgia patients. Hello, Shelley. Thank you for joining us. There's about 6 to 8 million fibromyalgia patients that are out there, and they think that at least that many, 6 to 8 million, are either misdiagnosed or undiagnosed, and so that's a real problem. And these patients have had pain for decades. Well, here's another thing. They did a study way back about 10 years ago, and they found 25% of all Americans have chronic low back pain. So we're talking about conditions that are long-term. And if you're taking the same medications and they're not working, why are you taking them? In my book, I use a little bit stronger word. Well, it's not bad words. Just why are you still taking this garbage? I mean, really, how long do you have to take something before it actually sets in and works? Now, I'm going to talk to you about a couple other things. What is chronic pain itself? And what is affecting your body? There's something called hypersensitivity denervation with somebody that has chronic pain. Hypersensitivity denervation is actually a research valid condition. It's something where you've had pain for so long that your body's stimulus has built up, and not only is the pain intensity greater, but it lasts longer. How many of you out there might even be sitting and relaxing and not doing anything? All of a sudden, oh gee, I got this really bad pain. That's that hypersensitivity denervation, that even if your nerve is not sensitized or stimulated, you have this severe pain reaction. Now, there's a difference between chronic and acute pain. Acute pain is severe new pain, usually within the last 24 to 72 hours. And that would be usually, if not almost always, because of some accident or injury. Of course, you can have acute pain from some conditions like appendicitis and so forth. But for the most part, we're talking about acute versus chronic. Acute, where you have severe pain from some trauma, where you have inflammation and so forth. Whereas chronic pain can have varying degrees. You can have acute or severe chronic pain, if you want to use that terminology, but the definitions themselves are quite different, where chronic pain is something that builds over a long period of time. It has peaks and valleys, but usually for fibromyalgia patients at least, one of the definitive things is 3 months of pain that travels all over your body. Now, you can have chronic pain for low back pain. That doesn't mean you have fibromyalgia. So there is a big differentiation between the two. Here's something that you have to take into consideration. Chronic pain after 6 months is considered by most insurance companies, Medicare, Social Security, is actually considered not only something that is chronic that you will have for the rest of your life, but it is for the most part not even treatable for improvement. So hopefully those people that have had long-term pain actually looks into this. We in our clinic have worked with patients that have come in with long-term pain, and especially with fibromyalgia patients, so obviously they've had it longer than 6 months, and we're able to work with them with our protocol. But for the most part, I would have to say that a lot of conditions you may find that are difficult to handle, especially injurious times, those that are from injuries. And we're talking many times, I work with personal injury cases, and after 6 months, it's really considered a lifetime chronic, even though there are things that you can do towards that, which is very, very interesting. Now, there's another term I want you to understand. It's called perceptual dominance. Now, perceptual dominance is very, very interesting, especially after a trauma. That's why, if you don't mind, I worked in insurance companies for years, and especially with a trauma auto accident, they like to see you disappear quickly because of what I'm going to talk about. There's something, like I say, called perceptual dominance, that after an injury or an accident, especially automobile accident, you're often injured in numerous places, but the one that is most severe will actually have the most pain, and that's the one that will actually be most bothersome. As the patient starts to heal and improve, all of a sudden other areas show up because that perceptual dominance now has changed. Let's say originally from an accident, as an example, you had neck pain from whiplash. Now that starts to settle down. All of a sudden you have headaches, and they weren't really in evidence before. Oh, well, that's something else. And then as the headaches settle down, now you have back pain from this same accident. And as that settles down, now you may have knee pain or shoulder pain, so forth. So it's very, very important that you write down everything that you have from an accident or injury so that you can keep track of these things, because your symptoms will change. Your symptoms will change dramatically many times just because of your healing capacity within your body. Now, for fibromyalgia patients, if you have a trauma, it's going to take longer. It's going to take longer because your body is not able to cope with the healing capacity. Keep in mind when I said that with our protocol and with our research, we found that your mitochondria, those ever-ready batteries in your body, are not producing enough ATP for energy, and that's also for healing. Also, the excess calcium in your body actually causes your muscles to constantly be in a state of activity. I mentioned this before. And so you don't heal because, again, you're not able to sleep, and so you don't reach deep REM sleep, and you heal during deep REM sleep. And so that's very, very important. Now, if you're going to be taking medications, again, it's very, very important that you understand some things. Especially, I'm going to use the example because I speak so often with groups with fibromyalgia patients. Lyrica Cymbalta and Savella are those most common medications that are used for fibromyalgia patients. There's others, everything, opioids to you name it, okay? But those are the most common. You have to understand that these have a lot of side effects. There's partial and then there's severe side effects. Now, for Lyrica, which is actually developed as an epileptic medication, okay, if you look up the history of it, it's an epileptic medication, and it has very, very similar symptoms to those of fibromyalgia patients, such as body and joint pain, fatigue, memory and concentration loss. My goodness, those are the same things that fibromyalgia patients have, right? So if you're going to be taking these, you want to make sure, any medication, I don't care what it is, that you only have a short term with these medications, because most of these do have side effects, and those are just 3 or 4 of them that I mentioned that actually will cause your existing side effects to be worse. So it's very, very important that you understand the differentiation. Here's a question from someone: can overactive thyroid be linked to fibromyalgia? You know, that's very, very interesting. Thank you very much, Linda. At one time, especially in Arizona, the Dr. St. Aman's protocol was very, very, very popular with all of the fibromyalgia groups within town. However, a doctor came in, I believe from Kansas City, an MD, and he spoke on how the thyroid condition actually caused fibromyalgia. And so people started going on thyroid medications, and if you're going to take any kind of medication, you have to keep it actually controlled under a physician. And so a lot of people were taking indiscriminately thyroid medication to see if it would make a difference. It has been found that, again, thyroid is a common condition under fibromyalgia, but it is not fibromyalgia in itself. I'm just telling you from research. I'm just telling you from my 30 plus years experience working with patients. Fibromyalgia patients, some have thyroid conditions. It is a treatable condition, but it is separate from fibromyalgia. But fibromyalgia will make it worse, and so you have to understand that. But thyroid is not fibromyalgia in itself. Fibromyalgia is a separate condition, and as I mentioned to you numerous times, that fibromyalgia makes all the other conditions worse. And no one that I've ever come across that has fibromyalgia just has fibromyalgia. They have usually at least one, if not more, conditions that actually sometimes mimic fibromyalgia in itself. So keep that in mind. Now, I was looking up, it was very, very interesting. I was looking up the different Google meds as far as what might be considered as far as a answer to some of these things. There are other treatments for pain that do not have side effects for the most part. They include, as I mentioned, I think last time, marijuana, and even if it's with or without THC, many times that is a factor. But marijuana has turned out to be very, very helpful in the reduction of pain, as I covered in a last live video. Other answers: acupuncture, which we use also. I've been practicing acupuncture for about 30 plus years also. It's wonderful. We give patients, if you don't like needles, we give patients take-home acupuncture. Not needles, but actually treatment areas that they can actually stimulate for the pain. Electrical stimulation. Now, I'll get to some questions here very, very quickly, but I'll just cover these other things first of all. But thank you very, very much for your questions. Really appreciate it. But some of the other things, now electrical stim has a couple different factors involved. Since electrical stimulation involves so many different types of electrical stimulation. Almost everybody's heard of the TENS unit, transelectric nerve stimulator. It only works for about 60% of the patients, however. It's called Melzak's gate theory, where it blocks the gate from producing pain. For those people that are fortunate enough that TENS units work, great. that's super. But don't be surprised if it doesn't, because it doesn't work for everybody. We use in our clinic something called interferential electrical stimulation, where it stimulates endorphins, which are your natural pain relievers, and it disperses the inflammatory material so that it's easily picked up and evacuated through your body. Electrical stimulation, again, is a wonderful thing, especially for acute patients. There's a number of different types of electrical stim, but those are the two most common, I think, that we use. Chiropractic is excellent. A chiropractic has shown through research, independent research, that actually stimulates endorphins, which are your pain relievers. Now, I'm not expecting people when first of all, there's a variety of different chiropractic techniques and so forth. We use probably one of the safest, one of the most professional, and very, very subtle as far as adjustments are concerned, so that we do not manipulate or aggressively adjust fibromyalgia patients, because when I first started, I did that, and then I didn't see them for a couple of weeks because of the additional pain. So we're a very, very gentle type of treatment. Some other things, massage, but I wouldn't do any deep tissue massage. Again, I've had patients go and get deep fibromyalgia patients, and also acute patients. You have to let the treatment settle down, or the condition settle down a little bit before you start doing anything deep, and you do it a little bit at a time, because massage can really stir up a lot of pain. Biofeedback is another aspect that could be used for some patients. Hey, look, there's a lot of things out there. If it works, great, as long as it doesn't have any side effects. Now, I covered this also with you before, and it's omega-3, and I'm going to get into that in just a few moments, because they did test years ago omega-3 and NSAIDs, non-steroidal anti-inflammatories, and I'll talk about that in just a moment. But some other things are cold. Now, a lot of fibromyalgia patients do not like cold. A lot of patients don't like heat. So, but if it's acute condition and there's redness or so forth, you might want to try a little bit of it. You might want to try the cold versus heat, and I'll explain to you in just a few moments. Cold actually is something that actually causes a constriction of the blood vessels and slows them down and doesn't allow for the pain to travel as quickly. Whereas heat opens up, it dilates the blood vessels, and then it allows for additional fluid in an area. If you already have swelling in an area, you don't want to put heat on it, because heat will actually congest it, put more pressure on the nerves, and cause more pain in the long run. It takes longer to get rid of that then. Whereas cold inside of a towel, cool packs in certain areas might be very, very advantageous for you, and very, very helpful if you want to try it. How long? Well, cold, no more than 10-15 minutes in one area, and move it to another area. So 10-15 minutes on, about a half hour off. You might want to try that. And then there's the old rest, ice, compress, elevate. Rest, obviously rest if you're in a lot of pain. Ice on that area, not directly on your skin, inside of a cloth. Okay, you don't want to burn the skin. Compression, light compression in an area, and elevate if it has to do with a limb or whatever else. Try to elevate it, and that would be great. Now, we were talking about some other things, and that would be NSAIDs, non-steroidal anti-inflammatories, versus omega-3. And they surgeons did a study a number of years ago at their convention, and they actually found that omega-3, the eicosapentaenoic aspect of it, is a natural anti-inflammatory, and it blocks the brain from producing prostaglandins, which is your primary source of inflammation and pain in the body. Whereas NSAIDs do have side effects, and so when they did the tests on patients, they found that the patients, if they had a choice, they chose omega-3 over the NSAIDs, believe it or not. You have to take the correct amount. You have to take minimum of 3,000 milligrams of the EPA portion of omega-3. 3,000 milligrams minimum. Okay, so you got to look at the bottle, as I mentioned. You got to turn it around and figure out how much it is in a bottle. Just because it says in the front 1,000 milligrams does not mean that you're having 3,000 or 1,000 milligrams of EPA. Okay, chances are you're going to probably have to take 5, 6, 7, depending upon the manufacturer, or more of the omega-3. Even if you were to take and eat fish 3 times a day, 7 days a week, 365, you still can't get enough of the concentrated EPA into your body. So that's very, very important. Now, other things that they, yeah, this is from Mayo Clinic, of course, and they said acetaminophen, acetylsalicylic acid. Acetaminophen is your Tylenols. Acetylsalicylic acid is your Bayer aspirin, so forth. However, if you're on our protocol, then you have to stay off of the salicylates because that blocks the body from producing. Or evacuating the body from the excess calcium and phosphate in the body itself. So there's a lot of information that is out and available for pain relief that doesn't have side effects. Keep that in mind. Side effects are actually, what are your symptoms? Ask yourself, what are your symptoms? What are you actually struggling with at this time? Look at the wrapper inside the medication and see what kind of side effects they have. Or look it up on Google. Almost everybody has, obviously, a computer like myself, and just look up side effects of this or that drug, whatever it might be. Let's see, what else do I have? Okay. Oh, that's something else. This is fascinating. I just came across a really serious condition, and it's called Stevens-Johnson syndrome. It's really quite severe. It's triggered by some medication or some inflammation or immune system problem. And they don't know, physicians, scientists don't know what medication is causing this. It might be a combination of things like your weak immune system and you're taking medication and so forth. And the problem with this is that it is a severe condition. I got to review this because I just came across this also myself, but it causes severe blistering of the lips and the skin of your body. It is a medical severe case, and you have to go to the hospital for this and get proper medications. It's so bad it covers your body. It can be anywhere in your body, and what happens is your skin blisters, then it peels off, and your skin comes back, but many times with lumps and bumps and irregularities and so forth. Not trying to scare you, but you might want to look that up. It's called Stevens, Stevens dash Johnson, Johnson syndrome. Very severe condition, reactions from medication or a weak immune system or some infection. And so for many of you that are on medications, your immune system is already weak. You want to make sure that you don't have something like this, because this can take many months for it to actually get completed through your body. So that's very, very important. I hope I answered your questions as far as the thyroid is concerned. As far as our hormones, a factor as well. Yes, keep in mind that when you have a whole body condition such as fibromyalgia, hormones can be adversely affected. And especially if you're already having a problem. Are you having cysts? Are you having abnormalities as far as your hormones are concerned? Are you having a variety of different ups and downs and conditions and so forth? Again, if you're taking medications, make sure you check. If it's not on a wrapper, check with your doctor and see how this is adversely affecting you. Because these are pharmaceuticals. They're not natural products, okay? Natural products would not have adverse effect, of course, unless you have some condition that you cannot have certain foods or some natural things. But those are tests that are separate that need to be taken. But for those people that have hormonal problems, I would strongly suggest that you check very, very closely with medication that you have and see if there are any adverse effects to especially your hormones itself. So read labels, read information, make sure you take care of everything to take care of yourself. Don't assume anything. You know what that word assume means, okay? And as far as pharmaceuticals, like I say, look, you should be able to get within about 48 to 72 hours a positive response from your medication. If you're not, check with your doctor, see if you can get something else. I don't suggest that any patient can just drop medications, especially medications. You're not supposed to stop them just by yourself. Make sure you get your physician's care to wean yourself off these medications. And let's see. Can overactive thyroid be linked to fibromyalgia? I think I covered that already. And also hormones. All of these things are, again, adversely affected either by fibromyalgia or by their related conditions like lupus, like hypothyroidism, like hypoglycemia, so forth and so on. There's diabetes. There's about 12 different, very, very similar symptomatic conditions that often are tied together. And as I mentioned over and over, that's why your doctor is having such a difficult time differentiating fibromyalgia from all the other ones, especially since there are no real tests that can be run that actually show you that it's specifically fibromyalgia. It's one of those things where it's actually symptom related, and the doctor has to listen to the patient as they run through all the different symptoms. And I'm sorry to say, but most allopaths, MDs, DOs, and even a lot of chiropractors that are just running through patients, they forget that they need to listen to the patient. What does the patient have as their problem, long-term, short-term, and go with that. That's most important. And we pride ourselves with that in the clinic. I want to thank everybody so very, very much for your questions and for joining me. And next week we'll be having another exciting subject. Check with Facebook, and also check with the Fibro Wellness Center. We'll be sending out messages as far as what we'll be talking and discussing. And I really, really appreciate your not only attending but also asking questions. I do hope that I've answered your questions properly. Any further need or anything else, just go through Fibro Wellness Center, and we'll see if we can add to that. Thank you, thank you, thank you. Have a wonderful week, and look forward to seeing you next week. Invite your friends and family. Bye-bye.